So if I put my finger right in the center of that joint, all I'm going to do is just draw a line straight up. Okay? Just to help you find it. I'm going to draw a line straight up. And when you draw a line straight up, you're going to come to a muscle that sits there. And it's a teardrop muscle. You see it on people who have great leg development. The bodybuilders have it. It's called the teardrop muscle. It's known as the vastus medialis obliquus. Big fancy word. Can you make a leg muscle like that? Yeah. See this teardrop right there? It's outlined here. That's the teardrop. It sits right here. It's going to sit underneath that muscle right there. So I want you to find that center of the knee, draw a line up, and kind of make a leg muscle like that. Squeeze it. Feel that muscle pop out right there. And I want you to put your fingers up underneath that right there. That is a canal that sits there. It's called the adductor. Adductor just means inside towards. Adductor canal. It's also called Hunter's canal. But that's where stuff gets trapped. And nobody ever looks here. Usually because it doesn't hurt there. It hurts in the knee, or it hurts in the hamstring, or it hurts in the calf. So you're going to have that artery come down, and you're going to have the vein as well that sits right here. And when that canal gets trapped, this blood from here is going to go deep. And when it goes deep, bend your leg a little bit, it comes into the back of the knee here. So the blood flow in the back of the knee, called your popliteal behind, is from here. So you'll get choked off behind the knee if you're choked off here. And then if you get choked off behind the knee and you get choked off here, what's going to hurt down below? Anything that wants. The calf is going to get tight and tense. It's going to hurt. You're going to get itis down here, plantar fasciitis, right? All these sorts of itis means inflammation, okay? But this can be really, really super tender, like a very painful spot. Why is it painful? Because stuff is stuck there, muck is stuck there, and then you impact the nerves around the knee. Right? So that one, you're going to struggle to find a pulse point on. I just want you to find the spot. So go up underneath that muscle and then do this, kind of go back and forth. Does that hurt? If it hurts, that means it's blocked. How are you doing?
Sorry.
Okay. And we're going to use the techniques that I'm going to show you in a moment later to free that up. Okay. Like that's one right here, just a glide like that. Look, what's happening? Do you see this artery and you see this vein? What happens when I do this? What's happening to them? They're moving, right? And I'm opening up space. So I'm going to drain the artery, I'm going to drain the vein, and I'm going to free up the lymphatic flow at the same time.